Let's take a look at pathogen group number 6, and our first pathogen here is Chlamydia trachomatis, which is the cause of trachoma and genital chlamydia. We're going to first take a look at characteristics of all chlamydias. They are all tiny obligate intracellular parasites. That means they have to live inside of other cells. They have oval-shaped cell walls, and they come in two versions, as elementary bodies and as reticular bodies. So here on this image over here, you can see the reticular bodies over here. They're very large. They have weaker cell walls. That's the actively reproducing form of chlamydia. And then here would be sort of the spore version of it. The elementary bodies, they're smaller, they have much stronger cell walls, and they are the ones actually that transmit the infection. Here's a lovely picture of somebody with trachoma in the eye. You can see this infection of this conjunctivitis, very red here. I mean, it's totally inflamed, as you can see. That would be transmitted by ocular discharges from person to person, and it causes vascular invasion of the cornea, and that of course can lead to blindness. If you have any kind of turbidity in the cornea or in your lens, of course, that would lead to blindness. And here it's listed as the #1 cause of blindness in the world. It can be cured with an antibiotic treatment, with antibiotic ointment. And here, moving on to genital chlamydia, that's very common in the United States. It's by far the #1 most often diagnosed sexually transmitted disease in the United States. It is a reportable disease, but a lot of times it's not reported because many times it doesn't really cause big problems. It does lead to a chronic infection of the urogenital membranes. The symptoms are often slight or no symptoms at all. And so a lot of times women, they get diagnosed, but they didn't have any symptoms, so it doesn't even get reported, even though it is a reportable disease. However, if untreated, it can cause sterility in either men or women. And PID in females, PID stands for pelvic inflammatory disease, and that increases the risk of tubal pregnancies. That of course would be not good. A lot of times you see co-infection with gonorrhea, another sexually transmitted disease, of course. Here will be a newborn that was born to a mother with chlamydia, and so you can see the chlamydia in the neonate's eyes. It's all kind of crusty there, and you can see the discharge. The chlamydia diagnosis is usually done with nucleic acid amplification tests. That's the standard procedure. That would be a PCR test. The nucleic acid hybridization, I don't think is done very often. Cell cultures is not done. It's very difficult because it's an intracellular parasite. So the method of choice is clearly nucleic acid amplification test, PCR testing, basically. And sometimes you can do monoclonal antibody testing. That's also done frequently. Moving on to lymph granuloma venereum, that is also caused by Chlamydia trachomatis, a special strain of that chlamydia, and it causes these very enlarged lymph nodes that are specific or characteristic for lymph granuloma. Here you can see in the groin area, inguinal area, that of these patients, that they have these very swollen lymph nodes that are bulging here. So right here too, very swollen lymph nodes. And here's another disease that is caused by chlamydia, and it's caused by Chlamydia psittaci, the cause of ornithosis. And the old name is psittacosis or parrot fever, because the reservoirs is birds of all sorts, birds of all kinds, and usually transmitted by the inhalation from feces or secretions of birds. So person to person is rather rare, but most people get infected because the birds, they're pooping, and then their fecal stuff mixes in with the ground dirt, and if that blows up into the air and you're inhaling that, that could be how you get infected. It's a systemic disease. It means it's body-wide. You can have these flu-like symptoms that can be severe. And so here would be a kind of sounds like coronavirus in a way. Fever, chills, a headache, photophobia means you don't want to be in the light. You cough and your muscles hurt, the myalgia. Okay, our next pathogen is Bacillus anthracis, the cause of anthrax. This particular bacterium has caused some scares of bioterrorism and whatnot. It's a gram-positive bacillus, spore former, has a capsule, has no motility, is aerobic. And it used to be a fairly common bacterium, but it's rare in the United States, except if you get it as a powder, I guess, in the mail. Somebody's trying to do something bad. The reservoir is animals, wild or domestic, and the spore is known to survive for thousands, if not tens of thousands of years. And so it's can be resting in the soil or in animal products for tens of thousands of years, literally. They found anthrax spores that were 20, 30,000 years old. And there are many modes of transmission. Now here, this would be a cutaneous anthrax. So this would start as a lesion, skin lesion, and then you can see these sores that are breaking open here. That could be the whole thing could become systemic, so body-wide. There is a vaccine available, but I think it was only given to high-risk military people because there were some vaccination concerns, some side effects. So the most common forms of anthrax here, skin anthrax, and has a 20% fatality rate, which is high, of course. Then here's some more information, but this is not really relevant right now. Everybody talks just about coronavirus, and anthrax is sort of sidelined for now until we have that one back, maybe, who knows, at some point. Anthrax in the GI tract is much more fatal. So the fatality rate is 25 to 60% listed here. But again, it was considered at one point a big threat for bioterrorism, but right now we're dealing with other things. And so here, anthrax was high on the list of estimated or hypothetical biological attacks or pandemics or deliberate bioterrorism kind of attacks. So we talked about smallpox as a potential bioterrorist weapon way back in one of the other pathogen groups, but here are some of the other contenders that were high on the list for potential bioterrorism, and you can see anthrax right here on top of the list. Tularemia is also here. This one, because you can spray it with crop dusters, and the infectious dose is just really low. Typhus has caused epidemics, of course. Tick-borne encephalitis, brucellosis, Q fever, some of the other contenders here. But anyway, let's move on to pathogens of meningitis. And so here we're going to take a look at Haemophilus influenzae, Neisseria meningitis, and they are listed right here, these two sort of side by side, and reported cases by age group. And you can see that it's especially often seen in very young children, and then in older people again. But both of these can cause meningitis, Haemophilus influenzae, and then Neisseria meningitis. Let's take a look at those. Here's a third one listed, Streptococcus pneumoniae. But anyway, so here are cases per 100,000 of the population, and you can see Haemophilus influenzae especially, it spikes basically in babies a year or less in age, so very young babies. Also, relatively often seen these Neisseria meningitis and Streptococcus pneumoniae. So the first year of life, there is this risk for these babies, for babies in general, to have meningitis. And here, meningitis symptoms: severe headache, that's a very typical symptom. Also vomiting, high fever, vomiting, stiff neck, dislike of bright lights. All of these are meningitis symptoms. And here's some epidemiological information about meningococcal disease incidence. Here you have the time span 1970 to 2015. You can see in general a decline with some spikes some years, but in general the incidence of meningococcal disease has been going down. So here, let's start with Neisseria meningitis. That's the cause of meningococcal meningitis. So that's the disease name, and here's the bacterium that causes it. It's a gram-negative diplococcus. You can see two cocci together, so diplococcus. They're also often referred to as the meningococcus. There are healthy carriers. You do have transmission by droplets, so sneezing, coughing could transmit. Yes, somebody with a bad case of meningococcal disease. So here you would have the typical petechial rash that you see here. So the blood vessels are broken and you can see the blood underneath the skin kind of shining through. So you have these intradermal hemorrhages. Very typical symptoms would be high fever, intense headache, the stiff neck, the nausea, petechial rash, and then it could lead to delirium, eventually coma, and you could die. There's a need for very prompt treatment, but there is also a vaccine for high-risk adults available. Here is a sad picture of somebody with a fatal case of Neisseria meningitis, and you can see the broken blood vessels, the petechial rash all over that face. It's very sad. Here's another bacterium that can cause meningitis, and that's Haemophilus influenzae. Do not confuse this one with the flu. It has nothing to do with the flu virus. This is a bacterium. It is typically the first vaccination that children get. I think as young as 2 weeks of age they will get the Hib vaccine. So Haemophilus influenzae type B translates to the Hib vaccine. It's a gram-negative bacillus. Also causes various local infections. It can cause bacteremia, meaning that your blood carries a lot of these bacteria, and it can also cause pneumonia. And it is a routine infant immunization, typically the first one that babies get. So here would be Haemophilus influenzae type B and the cerebrospinal fluid of somebody with meningitis. You can see the bacterium right here in the cerebrospinal fluid. Here would be the Hib, the Haemophilus influenzae bacteria in the sputum of somebody with pneumonia, and there again you can see the gram-negative bacterium. And moving on to our very last slide here for this pathogen group number 6, sort of the epidemiological data here associated with Hib vaccine. Very successful vaccination program that became available here in the 1980s first, and it led to the immediate decline of cases of Haemophilus influenzae. And so countries having introduced the Hib vaccine in 1997 and in 2015, and you can see the very strong success of this vaccine. So as usual, please fill out your pathogen sheets. Make sure that you stay organized, that you stay on top of things. This particular pathogen group will be tested in our lab quiz. I'm not sure if we're going to do it next week since we have that lecture exam coming up, but we'll have to see how it all plays out. Just stay tuned. I might keep this one open a little bit longer so you have more options on when you're going to take the lab quiz. But once you take the lab quiz, it will be on this pathogen group, and it will be also including the worms lab. Okay, so be sure that you take a look at the worms lab, some of the terminology surrounding worms, and then also this pathogen group number 6.